we'll turn to Dr. Ashish Jha. He's the director of the Harvard Global Health Institute. Dr. Jha, good morning to you. We see this headline. It's a jarring one that the U.S. sets its highest record ever of single-day new cases of coronavirus. How alarming is this to you?
So good morning. Thanks for having me on. It is pretty alarming. It's pretty worrisome. Obviously, we had hoped that we would be able to keep the virus at bay for a while, but we're seeing these resurgences largely because we opened up too quickly and we opened up without the right safeguards in place. And I'm worried that we're going to see continuing increases in number of cases in the days and weeks ahead unless we really take much more significant action.
And I'm sure you feel like a broken record on this, but I think it really bears underscoring. A lot of folks are probably sitting there going, okay, we have this 46,000 number of cases. Sounds terrible, is terrible, but we are testing more. And many of those cases we now know are young people who don't get as sick. So is that needed context right now? How do you see it?
So context is always important, and what we know is the following. First of all, we have very good evidence that this is not just about more testing. Hospitalizations are going up, and we are clearly identifying more infections, and more people are getting infected. So it's not just about more testing. In terms of young people, I have two comments. First is we know young people can get pretty sick as well. We just heard about the teenager who died. We don't know the long-term effects of this disease, but more and more evidence suggests that there may be real consequences. And then, of course, young people don't just stay among young people. They go spend time with their parents and grandparents and get other people sick. So I unfortunately just don't take a lot of comfort in those two pieces of data. I'm still pretty worried about where the trend is heading.
Well, and let's look at these hotspots. You've got Texas, California, Arizona, Florida. They feel like they're at a tipping point. What needs to be done right now to stop this wildfire from getting really out of control?
Yeah, I think wildfire is a good analogy here. And what needs to happen, in my mind, a few things need to happen immediately. I do think those states need a public mask law that says you cannot go out in the public. You can't go into restaurants or public spaces without a mask. That's minimum. Second, I think all large gatherings, nightclubs are still open in places. Restaurants are open. I really think the state has to look at whether it can sustain having indoor restaurants at all. And then the thing that we've been talking about, all the public health people have been talking about, is these states have to put even more effort on testing and tracing, not just to find more cases, but to isolate people as soon as they're found to be infected so they don't infect other people. That's the strategy we have, and we've got to implement it right away.
I was going to say, it's a critical moment. Dr. Jha, thank you as always for your perspective.